Good day, ma'am. I am Chris Madaltayopon, your nursing aide for today, and I will going to demonstrate suctioning nasopharyngeal and oropharyngeal airways. And the procedure's purposes are to remove any secretions that obstruct the airways, promote ventilation, obtain some secretions for diagnostic purposes, and lastly, to prevent infection that accumulate from uh, secretions. And next, for assessment, we need to assess the client's clinical signs indicating for suctioning. Next, for planning, identify the client's identity. So, for the client with conscious, we have to ask him. But if the client is unconscious, we can check the hospital bracelet and ask the patient's relative if they are present, and lastly to the chart to verify the client's identity. Next, we need to determine the need for suctioning. Verify the suction order in patient's chart. And next, for post-operative patient, we need to administer pain medication before the suctioning. Also, we need to explain to the client what we are going to do and why, and the reason why we need to do it, and reassure the client that if he feels any difficulty of breathing, he or she can interrupt me during the procedure. Then next, we need to perform hand hygiene. Next, adjust the bed in comfortable working position. Lower the side rails closer to me. And if the patient is conscious, we need to assess him in semi-Fowler's position. And if the client is unconscious, remain in lateral position but facing to me. So, excuse me, sir, I just assess you in semi-Fowler's position. I hope you can cooperate. Thank you. Thank you. Next, the equipment should be in the area closest to me, and the table will be in waist level so that we can save time and effort. Next, place the towel or waterproof pad in the chest of the client to protect him from any secretions. Next, we need to adjust the suction to appropriate pressure. For the wall unit, for the adult patients, 100 to 150 mm per mercury, neonate 60 to 80, infant 80 to 100, and children 100 to 120 mm per mercury. Then for portable unit, for adult, 10 to 15 cm per mercury, neonate 6 to 8, infant 8 to 10, and for the children 10 to 12 cm per mercury. And next, put on gloves, disposable gloves. And we need to glue the end of the suction connecting tubing in a convenient location so that we are not going to have difficulties later on. Then open the sterile suction package using aseptic technique. open the wrapper of the container carefully, and to remove container, not touching the inside, only the outside of the package. So we need to be careful. Then afterwards, next we need to place a small amount of water soluble in the package, so that all in the sterile area will be in a sterile field should be not touching the sterile feed, so that it will remain sterile, and the lubricant package also remains sterile. And afterwards, place amount of water, increase the patient's oxygen supplement level, or according to physician's order. Afterwards, we need to put face shield or goggles or mask to protect us from the secretions also, and put on sterile gloves. Afterwards, we make sure that the dominant hand will always be sterile, because it will the one who manipulate the sterile catheter, and the non-dominant will handle the suction or the wipe port. Then for implementation, with the dominant glove, with the dominant hand with glove, sterile gloves, pick up the sterile catheter, and the non-dominant pick up the tubing. Then we need to connect it. Next, we need to make sure that the catheter is functioning. So we need to dip it into the sterile saline. Then test it. Afterwards, if it is working, we need to, before to apply it, we need to encourage the patient to take a deep breath. Then apply the lubricant into the sterile catheter. Mm, 2 to 3 inches, and place in the place in the sterile field. Next, using the non-dominant hand, remove the device, oxygen device. Excuse me, sir, I just remove this one so that we can begin the suctioning. And then hold the catheter in between the forefinger and the thumb. For nasopharyngeal suctioning, we need to insert the sterile catheter gently. So from the nostril, along the nostril floor, along with the trachea, and we need to advance the inserted catheter into the pharynx at least 5 to 6 inches. And before we withdraw, we need to make sure that we are withdrawing it in circular motion. So while withdrawing it, we need to suction. So when it was withdrawn, we need to flush it into the saline. Flush it to remove the secretions. Then if the first nostril is clear and the next one has secretion, we need to apply it also gently from the nostril into the nostril floor, next at the trachea, then advance 5 to 6 inches to reach the pharynx, then withdrawn in circular motion, then suction. Then after withdrawing it, flush into the saline. After that, in oropharyngeal suctioning, we need to insert the catheter into the mouth of the client. Then it should be also gently from the mouth, floor of the mouth. And take note that when we are going to insert, not to suction. Do not put the finger into the port because it will suction. And if there is anything, we need to advance it into the trachea. Next, advance the catheter 3 to 4 inches to reach the pharynx. Then afterwards, when we are ready to withdraw, so we need to rotate the catheter as it was being withdrawn. Then suction, and flush into the saline to remove any secretions. Then take note that when we are going to suction, it should be 10 but no more than 15 seconds suctioning. And afterwards, replace or put the oxygen device back to the nose of the patient. And advise the patient if necessary to take a deep breath if he or she felt better after the suction. First suction, then after flushing the catheter in the saline, we need to assess if it was effective and repeat as needed and according to patient's tolerance towards the procedure. And next, we need to wrap the sterile catheter into the dominant hand with sterile gloves. Then untouch. Next, allow at least 30 to 1 minute interval for the suctioning if needed for the client, but take note that no more than 3 suction should made. And if repeated, we need to encourage the patient to cough or deep breath between the suction interval. And afterwards, also suction the oropharynx after suctioning the nasopharynx. When suction is complete, we remove the gloves from dominant hand, and the catheter should be here to be coiled. The coiled catheter is here, and pulling it off inside. So we need to remove this one. The catheter should be inside like that, so that if there's secretion, not pulling or not peeling anything or not going to spread, to avoid any contamination. And we need to put in this way so that it will not spread also. And after removing the gloves, we need to put it in the proper receptacle. Then afterwards, we need to remove the face shield and goggles or mask, and also this one we need to remove if to make sure that put it into proper receptacle. Then perform hand hygiene. Next, turn off the suction device and place the oxygen in normal level. Afterwards, reposition patient if indicated, then readjust into normal. Then for evaluation, we need to reassess the patient, the respiratory status, including the respiratory rate, the effort, oxygen saturation, and lung sounds. Hi, sir. Can you please take a deep breath? Deep breath. Again. Again. Okay. Look like it's better now than before. And next, for documentation, we need to record the amount of secretion, the consistency, color, and the odor of secretion, size of catheter, and route of suctioning, patient's response towards the procedure. And also we need to document patient's pre-suctioning and post-suctioning vital signs, cardiopulmonary status, and ventilation measures. Before the client's Blood vital signs is for BP 140/80, temperature 36.5, respiratory rate is 30, pulse rate 110, oxygen saturation is 90, and the catheter is uh, what do you call it, this one, open tip catheter, French 16, then portable unit gauge 15 millimeter per mercury as per doctor's order. Then for the vital signs afterwards, the blood pressure is 120/80, respiratory rate is 25, temperature 36.6 degrees Celsius, oxygen saturation is 95 percent, and there is pulse rate is 95. Also, the client has no cyanotic signs, and it has white secretions. Also, before it has a breath sounds if auscultated, but afterwards, after the procedure, there is no sound crackles here for us. And that's all. Thank you.